Hi, my name is Shantanae. I'm going to be your nurse for today. I am a student at the University of South Alabama, and I am going to perform a head and neck assessment on you, okay?
Okay.
All right. This one. Hand sanitizer. All right, I'm going to inspect your head now. Let's see, your head is normal cephalic. Your eyes, your eyebrows, your eyelids, your eyelashes, your nose and mouth are all symmetrical on your face. Let's see. Your ears are also symmetrical. Do you mind if I palpate your scalp?
I don't mind.
Okay. Okay, so you have nice clean hair. I don't see any pests or anything like that. Hair color is red. I don't feel any abnormalities. Do you feel any pain or tenderness?
No.
Okay. So next we will test cranial nerve number 5, which is your trigeminal nerve. You're gonna clench your jaw and try to push it down, and you try not to let me, okay? Okay. All right, so I wasn't able to do that, so that means that cranial nerve number 5, which is the trigeminal nerve, is intact. We're gonna test the sensory portion of that nerve as well. So you're gonna close your eyes. I'm going to tap your face with this cotton ball. You just let me know if you feel it, okay?
Yes. Yes. Yes.
Okay. So the sensory portion of your cranial nerve number 5 is intact. Next, we will test cranial nerve number 7, which is your facial nerve. So I'm gonna get you to make some funny faces for me, okay? Gonna smile, gonna frown, gonna raise your eyebrows, going to squint. Okay, I'm gonna try to pull those down, okay? And puff your cheeks. All right, I'm gonna try to push the air out. Don't let me. Okay. All right. So that completes testing for cranial nerve number 7, which is your facial nerve. Okay. Next we will take a look at your eyes. Okay. All right. So your bulbular conjunctiva is pink and moist. Your conjunctiva is also pink and moist. Your sclera is white and clear. No signs of jaundice. Your eyes are even and symmetrical. No signs of ptosis. Your eyebrows, eyelashes, they're all symmetrical bilaterally. Okay. Next we will test your pupillary reflexes. Okay, I'm gonna shine a light into. Well, no. First we'll measure your pupils. Sorry. Okay. So we'll measure bilaterally to see if they are even. And they are. Both of them are size 5. So now we'll test your pupillary reflex. Okay, we're gonna shine this light into your eye to see if your pupils constrict. Okay. Okay, and it does, and that is direct pupillary reflex. Okay, we're gonna shine this light in your eye again, and we will. I'll take a look at your opposite eye to see if it also constricts, okay? Okay, and it does, and that would be consensual pupillary reflex, which is normal for both of your eyes because they both reacted to that light. Okay, next I'm gonna get you to focus at an object in the distance to see if your pupils dilate, and they do. And I am going to put this pin light in your line of vision, and you are going to focus on it when you can see it, okay?
Okay.
Okay, so both of your eyes converged, which is a normal finding, and they also dilated when you looked at this pin light. So that would be your accommodation factor of our Perla test. Your pupils are equal, round, reactive to light, and they accommodate. So next we will do our 6 cardinal gazes. gauge of light. Sorry, I can't call. Um, you're gonna follow this pen light with your eyes only, not your head. This will test cranial nerves 3, 4, and 6, which are your oculomotor, trochlear, and abducens. Okay? Alrighty. Okay? So you are able to parallel track with both of your eyes that light, which would suggest that cranial nerves 3, 4, and 6 are all intact and your eyes are working properly. Okay. So next, usually we would test visual acuity with a Snellen eye chart. Today I'm going to use my pocket eye chart so we can test your vision. Okay. Alrighty, so you are going to cover one eye, and I'm going to hold this approximately 14 feet from your face, and you read the line that you can see the clearest, okay? Alright.
DEFPOTEC.
Okay, so you were able to read the 20/20 vision line, which means that you see appropriately at 20 feet what you were supposed to see. If that test was abnormal, let's just say a 50/20, that means that you can see at 50 feet what a person at 20 feet can see. So you have good eyes. Okay. Next I will take a look at your ears. Okay. Alrighty. Okay, so your ears seem symmetrical bilaterally. Okay, I don't notice any redness. Do you have any pain or tenderness upon me touching or palpating?
No.
Okay. No redness or tenderness noted. External auditory meatus is normal. No drainage, no redness noted. Okay, we're going to palpate your helix. Okay, your antitragus, your tragus, your lobes, lobules, bilaterally. You have one piercing in each ear. Let's see, helix, antihelix, antitragus, and lobule. Okay. So next we'll do the whisper test. So you're gonna cover your ears, and I am going to not yet. I'm gonna whisper something to you, and you repeat to me what you hear. Okay. All right. So you can cover your ears now.
It's March.
Okay. Yes. So the fact that you were able to hear what I whispered, you passed that test. It means that you do not have any high frequency damage to your ears. Okay?
Okay.
Alrighty. Next we will palpate your lymph nodes, okay?
Okay.
Alright. Sorry, my hands are a little cold. Pre-auricular, post-auricular, occipital. You're really warm.
I know. That's
Submandibular, submental, subclavicular, tonsillar, okay, you hunch your shoulders for me and lean forward a little bit. Deep cervical. Okay, so I wasn't able to palpate any of your lymph nodes, which is a normal finding. Next, I will take a look at your mouth. Okay? Alright. It's okay. Alright, so your oral mucosa is pink and moist. Your hard palate is white and anterior to your soft palate, which is pink, and it's posterior to the hard palate. Your teeth look very healthy. Dental hygiene is really good. It looks like your wisdom teeth are missing. Are they missing?
Yes, I have
Okay.
them removed.
Okay. Top and bottom.
Yes.
Okay. So a normal person with all of their teeth would have 32 teeth. But since you're missing 4, you have 28 teeth. They are intact. Your uvula retracts when you open your mouth. Your tongue is midline. I'm able to visualize the veins underneath your tongue. Teeth are intact. Let's see. And can you open again for me? I'm gonna take a look and see if that's. Did you have your tonsils removed?
I did.
Okay, so normally, I would be able to visualize those, and we would tell measurements. But since you don't have any, then yours are absent, and that is a normal finding for somebody that has had theirs removed. Okay. Next we will test your olfactory, which is cranial nerve number 1. Okay, so you're gonna cover one nostril and sniff for me. Okay, other side. Alrighty. And I am going to get you to sniff something. You're gonna close your eyes and you tell me, see if you can identify this scent. Okay? Alright.
Alcohol. Alcohol.
Okay. Yes. So you were able to correctly identify the scent. So cranial nerve number 1, which is your olfactory nerve, is intact. Next we will see head, ear, nose. Your nose. We'll take a look at that. Okay. Alrighty. So your nasal mucosa is pink and moist. I am unable to visualize your turbinates, but if I was able to, they would be leafy red in color. And you have a slightly deviated septum in this left nair. I could tell that it was slightly deviated. Let's see. We will test cranial nerve number 11, which is your spinal accessory. So you're gonna hunch your shoulders for me. I wanna try to push them down and you don't let me. Okay? All right, you're gonna turn to face either direction. I'm gonna try to turn your face in the opposite direction. You don't let me. Okay? All right. So you passed both of those tests, which means that cranial nerve number 11, which is your spinal accessory muscles, are intact. Let me make sure. We'll final walkthrough. I didn't forget anything. You got your head and your scalp. We did your ears, your eyes, your nose, and your mouth, and your lymph nodes. We did those. Okay, I think that's it for today. Thank you.